Okay. Good afternoon and welcome. I'm Christine Squires, Americares President and CEO. The COVID-19 outbreak is now a pandemic with over 125,000 confirmed cases worldwide, including one in our home city of Stamford, where just yesterday we learned a city resident has been hospitalized due to the virus. This is a public health emergency on a scale most of us have never seen. We must practice good health and hygiene habits, keep our staff healthy, and continue to care for patients in our clinics in El Salvador, India, Colombia, and right here in Fairfield County, where we serve low-income families without health insurance. We know from our 40 years of experience responding to disease outbreaks, earthquakes, hurricanes, and other disasters that families in poverty are always the hardest hit. Those affected by poverty are least able to handle the economic impact of being out of work or getting that unexpected medical bill. Never before has it been so critical that Americares continue our life-saving work here in the United States and worldwide. That is why we are supporting health centers serving the uninsured with protective masks, gloves, and other critical supplies in response to this new coronavirus pandemic. And we're keeping our free clinics open in Stamford, Norwalk, Bridgeport, and Danbury to ensure these patients can receive care. Like many organizations, we take precautions to ensure the health and safety of our own staff. In our distribution center, Americares has provided staff with protective equipment and is organizing teams to work in smaller groups to lessen their risk of exposure. And effective Monday, all Americares headquarters staff will be working remotely. Americares is part of a community-wide effort, which includes Stamford Health System and community partners working to prevent transmission. And now I would like to introduce Americares Chief Medical Officer, Dr. Julie Varghese, who will tell you more about Americares' response to this pandemic.
Thanks, Christine. Good afternoon, everyone. Americares' response to the COVID-19 pandemic has focused largely on supporting frontline health workers so they can continue their life-saving and critical work. We are preparing by providing training in infection prevention and control, as well as preparedness and providing protective equipment for health facilities. We've sent shipments of gowns, gloves, and masks to hot zones, including China and Washington State, and are also providing similar supplies to health partners in California, New York, and Texas, so that they can continue providing care for low-income and uninsured community members. Personal protective equipment and basic preventative measures are critical to slowing down the spread of this infection. Americares is also working to increase awareness about how the virus is spread and also helping to dispel myths about the virus and this outbreak. We are promoting scientific and fact-based information in the community. There's a lot that we're still learning about COVID-19 infection, but what we do know is that infection is typically spread by close contact with persons and where one person is infected with COVID-19 infection. We're also hearing a lot about social distancing and the importance of that. We know that there is potential for infection to be spread when someone doesn't even know they have symptoms, so prior to developing symptoms such as fever and cough. And so in addition to being vigilant about social distancing, we recommend being vigilant about hand washing, covering your mouth when you cough or sneeze, avoiding touching your face frequently, and also staying home if you're sick. We encourage you to do this as well as your friends and family members, and also just know that we all have an important role to play in slowing the spread of this infection. Partnership is absolutely essential. And so we've been very fortunate to have a tremendous partnership with Stamford Health System. And so I am very pleased to present Kathleen Szilard to speak about Stamford Hospital's response preparation to the outbreak.
Thank you very much. I am Kathleen Szilard, President and CEO of Stamford Health. And before I start, I do want to thank Americares for inviting us to be here and for all the work that you are doing to help support the community. Stamford Health is incredibly proud to count Americares as one of our longstanding community partners. I also want to thank Governor Lamont and Senators Blumenthal and Murphy for being here to support our community and for all that they are doing on behalf of the residents of Connecticut during these uncertain times. I started out my career as a pediatric and neonatal ICU nurse at Albert Einstein Hospital in New York City. And as a nurse, I saw the importance of us in healthcare playing a calming and a comforting role in the face of uncertainty. That lesson certainly seems relevant for all of us today. I joined Stamford Health several years ago and took over the helm as president and CEO just 18 months ago. And in that short time, I have been repeatedly humbled by the dedication and passion of the team that I am honored to lead. During challenging times like this, they always step up. At Stamford Health, we are fortunate to have a brand new state-of-the-art hospital that was built with scenarios just like this in mind. We can accommodate a surge in demand and have a large number of isolation rooms that can effectively and safely handle COVID-19 patients. More than just a hospital, we also have amazing clinicians, including Dr. Michael Parry and Dr. Asha Shah, our infectious disease specialists, who are actually world-renowned, and they have been on the forefront of our preparedness with the clinical teams. We began our preparations actually in January. I remember Dr. Parry coming to my office and saying there's something going on in China. So as an epidemiologist, he knew something was happening, and we began to mobilize in earnest about a month ago, ramping up all of our measures as it relates to education of our staff, establishing emergency incident command structures, and monitoring our supply levels very closely. As an independent healthcare system, the vast majority of us live in this community, and so caring for this community is indeed very special and very personal to us. I don't need to look any further than the empty shelves in my grocery store to know that my neighbors are concerned, and you may have heard that we did, as you heard from Christine, we did have our first COVID-19 patient positive test results this week. But I take great pride and comfort in the simple fact that we and our partners are well prepared for and actually experienced in handling these types of healthcare crises. Earlier this week, we operationalized an isolated fast-track screening area off of our emergency department that separates out COVID-19 patients from the general population. Just today, we launched a COVID-19 hotline to address the specific concerns of our patients, visitors, physicians, and employees. That number is 203-276-4111, and it is staffed 7 days a week from 7 a.m. to 7 p.m. Early next week, we plan to open up a testing center to support our network of physicians who have many concerned patients that need to be comforted and sometimes tested. As we move through this challenge, which we will do, I look forward to working with all of you, including the governor, the Connecticut congressional delegation, including Senator Blumenthal, Senator Murphy, and Congressman Himes, and our mayor, Mayor Martin, who we work very closely with him and the public safety folks down at the city. And we will manage all of this together. Thank you very much.
Governor goes, right?
He's after the senators. He's after the senators.
Who's next?
You go.
Go ahead. Senator Blumenthal, go, then I'll go. Go ahead.
I am really proud and grateful to be back in Stamford, my hometown, and most especially at Americares, where I have visited many, many times. And I just, at the beginning, want to give a shout out to the folks who are out there right now in the trenches doing the healthcare work that is so vital, many of them exposed to these kinds of diseases all around the world, literally all around the world. And particularly, I visited with the Americares workers in Puerto Rico, where I was so inspired by their dedication, hard work, and courage in the face of very austere conditions. So to all of the Americares workers, volunteers, staff, board members, contributors, thank you for all of the great work you do every day. Regardless of where the headlines go, you are on the front lines, and Americares is going to be delivering equipment. This equipment behind me, the masks, gowns, and other equipment that is so important to keeping healthcare workers safe, but also a lot of this stuff which keeps individuals safe, and there are big boxes of Clorox wipes for people who should be using them, literally, to sanitize their hands. Washing hands is one of the most important things people can do. Today, the President of the United States is going to be doing an availability. My hope is he will declare a national emergency. Both Senator Murphy and I have called for a declaration of national emergency. A declaration of national emergency gives the President and the Congress powers to take the kind of robust, resilient action that will help confront this crisis. Make no mistake, we are in the midst of an epidemic that threatens the very fabric of our society, the future of our economy, and our public health care. We need to meet this crisis with action now. I was struck by your mention of Dr. Parry coming to you in January. That's when this nation should have taken action. When the experts came to the CDC and to our national leadership with the warning, something bad is happening and it's going to spread, back in January. We've lost 2 months, but we need now to confront this emergency by providing more tests, still no specific, no strategy, by providing paid sick leave to workers who otherwise may be tempted to go to work because they need the pay, more insurance coverage, unemployment compensation, and tax credits. That's the package that hopefully our Congressman Jim Himes here in this district, our congressional delegation, all of Congress will pass by the end of the day. And I would just conclude by saying, I think Senator Murphy and I agree. We should not be here. We should be down in Washington, D.C. We should be enacting and legislating a package of economic and healthcare emergency measures that hopefully will be passed by the House today. We should be there working over the weekend. The reason that we're not there is that Mitch McConnell has sent the Senate home. Mitch McConnell sending the Senate home betrays the duties that we have and that we should be demonstrating, enacting and legislating right now to meet this crisis. But hopefully we will do it when we go back next week. We owe the American people that kind of action, which so far has not been forthcoming from this administration. They've used magical thinking and happy talk, failing to recognize the crisis that was deepening, and testing is key. Americares can't do it, doesn't have the authority or the equipment to do it, but our nation can do it. And the news, for example, that New York will be doing automatic testing beginning right away, that Yale will be doing some testing in its labs, that others in Connecticut will be expanding testing, that's very good news. And it is due to the kind of leadership that we've seen from Governor Lamont, who has been out there every day and has worked with public health experts and his own authority in doing more than, frankly, the federal government has done to recognize the importance of this crisis. And we are grateful to Governor Lamont and the other governors who have recognized this crisis. They can make use of FEMA disaster relief funding under the Stamford Act. We've called for the President to consider those applications, and it's part of the aid that the federal government should be providing all across this country. Thank you.
Let me add my thanks to all the workers who make this warehouse possible, who distribute aid throughout the United States and the world. Let me compliment Governor Lamont on his decisive leadership. I think most Americans wish we were getting more leadership at the federal level from the executive branch, but Governor Lamont has taken several very important steps to make sure that Connecticut is as ready as possible and as prepared as possible. Let me thank the mayor and municipal leaders for doing the same. We're so grateful for the leadership that the private sector has shown, and Americares makes it possible for many of their private sector partners to do right, to be able to make donations that they then distribute to parts of the world, parts of this country, and parts of this state that badly need these resources, who can't afford them without the help that they get from Americares. And I want to thank the private sector across the state that's stepping up as we speak, showing leadership. I was just on the phone with the first selectman of Greenwich, and he was telling me about the community's efforts to step up and work with the municipal government to make sure that kids who are home for school over the next several weeks get the food that they need. That's the public sector and the private sector stepping up and doing the right thing. And I also want to thank Americares for their recognition that you can't protect America without having a global footprint. This epidemic didn't start in the United States. It started overseas. And there are a lot of people who perceive it as weakness for the United States to be involved outside of our borders. But the reality is you can't stop a pandemic from reaching the United States if you don't have the capacity to stop it somewhere else first. And I was glad to see in the original supplemental request that Congress passed $1 billion to really rebuild our global public health footprint so that we can perhaps make sure that we aren't caught unprepared in the way that we may have been this time around. And of course, globally, the public sector relies on the private sector. It's USAID and Americares that have partnerships all across the world. And then lastly, there's a limit to what Americares can do. There are core functions that only the government can provide. And we are hopeful that we will be back in Washington in 24 hours or 48 hours to vote on a second emergency relief package, this one directed at individual Americans. Americans who on Monday and Tuesday are going to have to make some real tough decisions about whether they go to work or whether they stay home with their child who doesn't have school. Americans who on Thursday are going to come home with a cough and decide whether they're going to stay home from work on Friday or whether they can't afford to miss a day of work. And so our job this weekend and this week is to pass emergency sick leave and unemployment compensation to give confidence to Americans that we're going to be there for them as a government. We know that we have great institutions like Americares who are going to be there in the ways that they can supplement our response, but there are unique roles that the federal government needs to play, and I hope that we're going to be able to come together, Republicans and Democrats in Congress, to make that happen. With that, I don't know where to go next, but maybe I'm just going to hand it to the governor. So, as I said, I'm very I'm glad that Governor Lamont is there, and I think that a lot of Connecticut residents feel the same way today, Governor Lamont.
Well, thank you, Chris, and everybody. Christine, this is your first official day as CEO. I think we needed you here, and we need Americares more than ever. If you visit, you'll see health is on the way. That's the motto, and that's because basic health safety is key just to your life, but also to curing poverty and economic opportunity and growth and giving everybody a chance. And Americares understands that. It's just as true in Norwalk and Bridgeport it is in the other dozens of countries where you do work. And Senator Murphy mentioned the partnership is here. This is how we're going to get through this pandemic. We're here with Stamford Hospital. We're here with the mayor of Stamford. You're right, Senator Blumenthal and Senator Murphy. Get back to Washington, D.C. We need you. We need you to vote. As Chris just mentioned, we have more and more of our schools that are closing. You're going to get an update at the EOC, the Emergency Operations Center, today in terms of the status, in terms of those that are infected in the schools. But the point is, people are waking up, and nurses shouldn't have to decide between taking care of somebody at the hospital or at the nursing home or taking care of their child because there's no school. It's our job at the state government. Susan and I are taking the lead, working with the legislature on a very bipartisan basis, I got to tell you, what we can do in terms of daycare, what we can do in terms of unemployment compensation, so that anybody who's feeling sick, feels like they shouldn't be at work. I don't want any excuses. Go home, be safe, and we're going to do what we can in terms of daycare, do what we can in terms of workman compensation, do what we can to help the small businesses. We have more small businesses, especially in the service sector, that are falling behind right now. And what we can do in terms of forbearance on loans and other things, we'll be announcing that, what we can do at the state level first thing next week. And we need the feds to do that as well. And one last thing, Dick pointed out the disinfecting wipes. And you may say, why are we sending those out of state? Why are we sending those to China? Why are we sending those to Washington State? You know, we need them right here. And Americares reminds us every day, and frankly, COVID-19 reminds us every day, that this world is getting smaller. And you can't build a wall in the Rio Grande and think you can protect yourself. So I'm proud of what Americares is doing. And if they can do a little more for public health in places like China and Washington State and other places, that's good for them, that's good for their opportunity, and it's good for all of us. And that's why Americares is so important, why we're so proud to be here today.
Well, good afternoon, everyone, and thank you so much to Americares for the great work that you're doing at clinics in Connecticut and in our country and across the globe. We're so proud that you're located right here. The governor has been extremely proactive, and we've been working very hard with superintendents of schools across the state. They're concerned about their students, and we're working with each of them to ensure that our kids get the education that they need, that they stay safe, and also that no child goes hungry because they're missing 2 meals a day that they usually get at school. So we know that we've had dozens of schools and school systems across the state that have closed. We've gotten a USDA waiver for the federal school lunch program so that meals can be provided for kids who need them. Also, our early childhood commissioner is in the process of making sure that emergency child care centers are set up so that parents, especially healthcare workers, doctors and nurses that have to work extended hours, or people that need child care because of school closures, have the child care that they need. We're very proud of employers of all sizes across the state who've stepped up and tried to make sure that their employees can telecommute and that they have systems set up for child care for their employees who need it as well. Our state departments, like the Department of Transportation, has been working on a daily basis to make sure that they are disinfecting our trains and our buses with CDC-approved materials. And also our DMV has set up a system so that you don't feel like you need to go renew your license or your registration. Today you've got a 90-day extension, so don't worry about going to a crowded DMV facility. Our commissioners are stepping up at the state police. They've got a new class of state police candidates, and the state police has decided to do some of that training online. So the governor and I are just so proud of all of our commissioners. We're proud of all of our state employees. Our commissioners have really stepped up over the past couple of weeks and have literally been working around the clock to make sure that our state employees are safe and that our residents are safe. If anyone in our state needs information, please go to the State of Connecticut website. It has the most up-to-date information about coronavirus. And if you're still stuck, please do call 211. There's a dedicated line just for calls related to the coronavirus. And finally, just a word, just remember our neighbors. Remember seniors who are most vulnerable, especially the ones that live by themselves. Check in on elderly people and elderly relatives. And also, when you go to the grocery store, like I had the pleasure of doing very early this morning, please be considerate. Just get what you think you might need over the next week or two, because it's not worth getting into a fight with somebody at the grocery store. And we've already had reports of that. Excuse me. So again, thanks to our wonderful commissioners and state employees, and especially to our very proactive governor who has been leading so well. Thank you.
So I guess I'm to wrap up here, and I wasn't planning to speak, but when they put me in front of a microphone, no telling what's going to happen. So I had a few things to share. First of all, sincerely, I am so proud as mayor to have an organization like Americares within my jurisdiction. When there is a hurricane in the Caribbean, Americares is there. When there's an earthquake in South America, Americares is there. I think any mayor would be proud. I am the one that gets that joy, and so I thank you for what you do. And incredibly, I would go then to, in fact, yes, a thank you, because Americares operates a health clinic here in the city of Stamford, serving some of those who are most needy, who need help. And so I appreciate that as well, but that's the thank you that I offer that goes with the pride that I have as mayor. I also am thank you with Stamford Health Systems. They've been terrific throughout this crisis as it has emerged and continues to emerge. Dr. Perry is on the staff, is a leading doctor on infectious diseases known around the country. Again, I'm so proud and pleased that he is here and that you are here, particularly with your new facilities that enable you to do things that most hospitals aren't able to do. And again, I just express my thanks. We need to change our social interactions. And I am been told that if you go on YouTube, you'll find any number of videos about people saying that you shouldn't touch your face as often, and they're busy touching their face during the particular message. Excuse me while I get rid of that call. I was watching. Not a single one of these leaders touched their face, at least while they were giving this. I try to keep my hands in my pockets, and I can tell you it's like that story in Tom Sawyer, when you've got an itch and you're trying to not itch, it itches a lot. So right now I want to itch, but I'm keeping my hands in my pockets. When I first came in, every one of us greeted. We didn't shake hands. We did the elbow bump. We need to change our social interactions, keep our social distance, and in an odd sort of way, every one of these leaders here is showing you by example the way we need to change our personal behavior in order to keep everyone safe. The last couple of things is that I was on a conference call today with many of the small businesses that operate within the city of Stamford, restaurants, theaters, hotels, and I can assure you, Governor, senators, clearly on the top of their mind is that they're being hard hit economically by this particular outbreak. And while it is not the highest priority, I think we all understand that the public safety and health is the highest priority. They're immediately asking questions about, is there going to be assistance for those small businesses when their restaurant volume fell to 1/3 of what it used to be, and they have additional expenses to go on? And I know that will be a challenge for all the way around, but it is high on their minds, as I'm sure you already knew. I offered that I could not answer those questions, but we will certainly assist from the city of Stamford, but we're depending upon the state and federal government to give that aid to those that are being most impacted. And most impacted includes the lowest end of our income spectrum. The wait staff and the cooks that serve in those kitchens that are cutting back. A cut in the Social Security tax doesn't help you if you don't have a job. We need to do things to ensure that they get their health care, they continue to get their child care, they continue to be sustained while they are laid off due to this terrible virus, or that they in fact have to self-quarantine. And again, I'm looking to Congress. I know that you guys are working on it. I just want to speak my voice to add to that particular issue. The last thing that I will say is that the governor made an emergency announcement, or made emergency authority. I'm probably not going to say it exactly right, but essentially he did that a couple of days ago. That was welcome by me here in the city of Stamford. I believe yesterday he announced that all events over 250 people were no longer allowed. I am extending upon that order in the city of Stamford. I will be announcing today that we will also be limiting events between 25 and 250. And so we will have that announcement more formally, but essentially every one of our meeting rooms has a limitation on how many people can be in that room by the fire marshal's office. We're cutting that in half during this particular outbreak to reduce the social interaction. We cannot shut down the government. We cannot shut down our economy, but let's be smart. Let's be smart. Let's change our social interactions, spread things out. Let's keep our great country, our great state, and this great city of Stamford going. But this order will come out today to ensure that people can have the confidence that we're doing what we need to do in order to provide more space to live and work. And I thank you, Governor, for starting that ball rolling. We were already considering what we were going to do. The announcement that you were doing the over 250 was wonderful, but we also have to deal with the fact that 100 people in a small restaurant is just as bad or worse than 250 people in a very large room. I expect that our hotels have had many of their events canceled. The restaurants are already struggling. So in many cases, I don't think this will be an additional economic hardship, but nonetheless, it is something that I feel that we need to do here in the city of Stamford. And I don't know if we're going too far or not far enough. But I know this is something we have to do, and as this virus changes and grows, and as our scientific understanding becomes more firm, we will make the decisions that we need to make to keep people safe and at the same time keep our great country and our great state and our great city going. I thank, in addition, the leadership that is standing beside me. I really do appreciate the type of leadership that they offer to our state, and I just wish we had more of them. Thank you very much for all in your attendance. Are you going to wrap this up?
One more wrap up.
Yes, one more wrap up. You bet. And I forgot to mention, politicians at this thing, they always crowd around so that when you take the picture, you get to see all of them behind. Notice we all spread out this time. We're trying to do the right thing. Appreciate it. Take it away.
Thank you. I just wanted to wrap up and just thank you all for coming today, for raising awareness about our COVID-19 response, the best practices for all the steps that you've taken, and showing that we can't do this alone. Partnership is important, and that together we're stronger. So I just really want to thank you for that. And I do want to say, if you want to learn more about what Americares is doing, please visit Americares.org. And please, everybody, stay safe, stay healthy, and let's continue to support each other. Thank you.
Do you want to take a question?
Sure.
Yep, sure.
questions?
Governor, New York has just started drive-through testing. How soon will we see that type of response?
My understanding is that it's already drive-through taking the swabs and collection in a number of our hospitals. I can't speak whether Stamford's got it now.
It will be up by Monday.
Stanford's Monday, Greenwich is now. I understand that Stratford, I understand that Bristol. We're going to be able to take the swabs in the very near future. Our choke point, as you know, is actually being able to test and evaluate from there. We've doubled our capacity at the public lab. We're now at Greenwich and some of the other places. We're sending those samples out of state to Quest. They're beginning to expand our capacity to do testing as well. And I'm very hopeful that in the very near future, in the next few days, a number of our hospitals have got the green light to do testing as well.
And everyone would be welcome to come? How would it work?
Right now, I think it makes sense to get a note from the doctor. Exactly right. If you're not feeling well, stay home. If you're still really not feeling well, call your doctor. If you need a test, we'll be able to provide that with a doctor's authorization.
Doctor's order.
My understanding is we have, but if you wouldn't mind, they're going to give a full briefing at the EOC. I think it's in an hour or so.
The Fed just injected $1.5 trillion into the stock market yesterday to try to fix some of the problems COVID's causing there. Do you think Congress will need to take additional steps to help the markets?
Yeah, I mean, the $1.5 trillion injected in the stock market will help the investors, but the mom or dad who's deciding whether to stay home on Monday because their child is home with school closed or because their child is sick, the choice between taking care of a relative or going to work at a nursing facility or hospital or even any other work is right now imminent. The point is, what we're seeing, in effect, is selective bailouts and aid for people who are part of the economy but not the whole of the economy. What we need is aid for individuals, not industries. No bailout for the cruise ship lines, and we need more than just investment in the stock market. It has to be for people who go to the supermarket. So I think what we're facing, Senator Murphy said it very well, is individuals really going through a world of hurt. Moms and dads, individual small businesses, people who work in washing dishes or waitresses or ordinary work on assembly lines that may be cut back, they are going through a world of hurt. And they need aid right away. That's why we should be back in the Senate giving them that kind of assistance, because overall it would be best for the economy to have it moving at a higher rate, having that demand continue, having the stimulus there. And so the kind of monetary aid, the $1.5 trillion that the Federal Reserve has released, is no substitute whatsoever for paid sick leave, stronger unemployment compensation, tax credits and cuts for businesses, low interest loans for those small businesses, a panoply of economic aid.
Yeah, so I obviously agree that our focus in Congress right now needs to be on getting aid to individuals, and that's what I believe we will do. I do think it's important to note that this aid was not directed to the stock market. That is a popular refrain, but it's aid, that it's assistance intended to make sure that our credit markets don't seize up, that we continue to have a flow of capital available to the economy. And the Treasury and the Federal Reserve are going to have to take measures and undergo new programs to make sure that our economy doesn't come to a screeching halt over the course of the next several months. So I also think it's important to accurately label where this assistance is ending up. It will end up in the hands of publicly traded companies, and it'll ultimately end up in the hands of many other companies that aren't traded on the exchanges as well.
Oh, yes, there are some microphones over here. Go ahead. Yes, what's the question?
Is it meeting room and space in the government center, or is it all restaurants, all businesses?
All restaurants, all hotels, all businesses, cafeterias inside of office buildings, including the government center cafeteria and meeting rooms, the churches and synagogues as well. Any place where the fire marshal has designated a room that has a maximum capacity of whatever it is, we are cutting that in half during this coronavirus. We would hope it is, and it is relatively easy to regulate that because we already have something, and we have people in the health department in particular, but also the building department that inspect for those things. It is our hope that you take your event that is so important to you, where you have 100 people and you're in a room that's 125 people at the hotel, that now the hotel will say, okay, I've got to give you the adjacent space as well. You now have 100 people in a space for 250. Let's spread the tables out. In restaurants, the idea is not to close half the restaurant. The idea is people can be sitting at every other table rather than sitting right next to one another, shoulder to shoulder. It is to move directionally towards getting more social distance. I believe it is in the right direction of what to do. As I said earlier, I'm not certain whether it is too much or not enough. I know it's in a better direction, and I believe that we will have good compliance. I believe that for the most part, the drop in attendance and the cancellation of events will mean that this won't have significant impacts, but if there are some exceptions, I don't want to find out later that because of a big party at a bar on a Friday night, we now have a hot spot that's spreading coronavirus. And so that's what we are doing effective Monday. Thank you.
Thank you.